Hi, how are you today? My name is Bridget Page. I work in student services at the medical education campus for Northern Virginia Community College. Today I'm here with Jo McDade. She's an MSN RN and she works for American Public University, and she's here today to talk to us about her RN to BSN opportunity as well as her RN to MSN. I'd like to thank you for coming today and taking the time to share your information with our students.
Thanks, Bridget. I'm delighted to be here. American Public University system is a system that includes both American Military University and American Public University. We are regionally accredited by the Higher Learning Commission and offer 200 plus online programs. Today, I will be sharing about the RN to BSN and the RN to MSN nursing programs.
So let's get started. We'll start with an overview of your programs.
All right. We have 3 nursing programs: an RN to BSN, an RN to MSN, and an MSN program. All 3 are accredited by the CCNE. Our RN to BSN program has 8-week courses, monthly starts. We have a book grant that pays for all books for the undergraduate students, so no book cost. The students can transfer up to 90 credits into the program, and that means they can take all their electives at NOVA and bring them right on to us. And the last bullet on the left is kind of an exciting bullet. Chemistry and nutrition are not required. And then on the right, RN to MSN, 8-week courses, just as the RN to BSN, except for the MSN practicum course, which is 16 weeks. The reason why it's that long is because most nurses are working while they're doing their MSN program. And because they're working, and because we have a requirement of 160 practicum hours, that gives the students enough time to get those hours in and still work full time. Start dates for the MSN courses every other month. We have a concentration in leadership and education, and we have something called Open Educational Resources, OERs. The OERs are scholarly and current works that are used in place of books. That means when OERs are used, and they are used in most MSN courses, there is no expense for books.
That is great for the students because college textbooks is a big expense, so that will save them a lot of money.
It is exciting. So here's a slide about prerequisites. All that's required for the RN to BSN is a registered nurse license, a current active and unencumbered registered nurse license, and an associate degree or diploma in nursing. For the RN to MSN, the associate degree or diploma in nursing is also required, along with a current active unencumbered registered nurse license in the state where the practicum will be conducted. And the other requirements are a 3.0 GPA, a statement of understanding, a current resume, and a statement about purpose and goals for the master's program. Here's a slide to just share about some of the concepts that we highlight in our programs: evidence-based practice, scholarship, leadership, community, informatics. These are some of our programs these are some of our courses that we actually have. We have a dedicated course to these concepts. And the other concepts on these slides, such as clinical decision-making, collaboration, quality improvement, they are threaded through the programs. Down there on the left, you can see a highlighted program that's Caring for Today's Veteran. That's a very, I'd say, awesome course. Students learn about military culture and values, what may or may not be needs of veterans, available community resources for veterans, veteran services, and more.
Wow, that course sounds fascinating. I've never heard of that in other BSN programs, so that would be great experience for our students, especially that live in this area around all of our military bases.
Mm-hmm. Well, one thing I can say is that it's part of our philosophy too, that when we're doing a course together with faculty and students, we have the idea of learning more together. And I've had the pleasure and honor to teach this course numerous times, and I've learned something new every time.
So does your programs have deadlines?
Okay, so we really don't have any application deadlines. We have rolling admissions. For the RN-BSN program, the monthly starts, and for the RN-MSN program, the every other month start, we have people entering frequently into our programs all through the year. So students can apply anytime.
So what is the cost of your programs?
The RN-BSN program cost, that would be the undergraduate tuition, is $285 per credit. And down below in the blue box, one can see a tuition grant for military, and the details there are described, but it causes a decrease in the reduction of tuition from $285 to $250 per credit for military. Technology fee, $65 per course, $0 for military. The BSN nursing courses are 10 courses altogether, 31 credits, and there is no application fee, no transfer credit evaluation fee. It makes it very, very affordable. I did a calculation, and the total cost for the nursing courses in the RN to BSN program are $9,485.
That's really great. I mean, the students will get a good education, but they won't start their career with a huge debt.
Every little bit counts.
It does.
The cost of the RN to MSN program is, of course, a little higher because this program is made up of both the BSN and MSN courses. And while I'm thinking about it, I just want to say that once the BSN requirements are met, the degree for the BSN is conferred. The breakdown of it is, though, that the BSN courses are 11 in number, 34 credits, $285 per credit. And the MSN has only 9 courses and 27 credits with $370 per credit for the MSN courses. And why is that MSN credit load so small? Usually it's going to be up around 36. It's because we actually take MSN courses and embed them into the bachelor's portion of this program. And it's very streamlined and makes it even more affordable.
So since the courses are all online, where do the students take their tests?
Okay, so first I'd like to say that there is an infrequent use of traditional tests and quizzes, such as the multiple choice, multiple select, timed and proctored kinds of tests that students in their pre-licensure programs take. But when those few tests or quizzes are given online, they can be taken right in the learning management system.
So do the students need to be working while they're going through your programs?
Well, the quick answer is no. The programs are designed to accommodate those who work and those who are not working. Most nurses are working while they're earning their degrees, but some elect not to for reasons having to do with their personal lifestyle or life. We do suggest working when it's possible, and there are benefits to working while earning a degree, such as the student can apply the concepts learned from the classroom right to their clinical setting. And also, while you are working, you can, an outcome of it is developing professional relationships. And in those relationships, you actually expand your identity and professional role, as well as observe and learn how to carry out best practices in nursing.
So you gave a lot of information today, but if the students wanted to get a little bit more information, how do they get in contact with you?
Okay, students, please contact me via the phone or email that you see on this slide. I'm happy to give you some more information and can guide you to those who can provide more if I don't know the answers. So please give me a call or come visit during virtual office hours. You can see those virtual office hours on the MEC Exchange blog. I have 2 coming up soon and look forward to seeing you there. If you'd like to request information from our online application, right down there on the right, you can just email amuonline.com or study@apu.com, and one of our dedicated mission representatives will reach out and provide you with information. And they'll help you get started and help you with next steps when you're ready.
That's great. I want to thank you so much for taking your time out of your schedule to give information to make it a little bit easier for our students.
Thank you. It was my pleasure to be here. And thanks for your invitation.